love the North Country. I love the small towns, the land, the farms. I love being outdoors through the changing seasons. Raising my family here has been a blessing. The North Country is truly home to me and my family.
I grew up in Canton, went off to college, served in Vietnam, married my wife Nellie, and returned here to Canton.
My dad was a pathologist in the Potsdam lab. I returned here to practice and raise a family. We have a wonderful community, great people. I want to be sure we have excellent medical care for them, with services that keep people here close to their roots and close to what's comfortable and familiar, close to home.
At Canton-Potsdam Hospital, our goal is to be the model for how healthcare is delivered in a rural community. That requires ongoing investment in technology and facilities, and dedicated professionals working together as a team with a passion to give their best.
CPH has a history in Canton, and this initiative is evidence of our ongoing commitment to meeting the needs of Canton residents. My dad actually served on the E.J. Noble board during the merger of the Canton and Potsdam hospitals, and I myself just completed 25 years on the Canton-Potsdam Hospital Board.
A strong community hospital is essential in a rural environment. We're proud of our 85-year tradition of providing caring beyond medicine. We deeply understand the responsibilities that we have to meet the needs of our patients. When we opened our doors in 1925, there was one paid employee. Now, there are more than 800, with 60 physicians on staff.
We've made great strides in recent years to bring CPH to the next level. We knew our region was critically short of healthcare providers. To counter this, we've recruited more than a dozen new physicians, but our existing medical office space is completely occupied.
CPH is in the midst of one of the most ambitious construction projects in its history. Building or renovating 3 facilities at 3 different locations simultaneously. First, we're completing an annex to the E.J. Noble building in Canton, which will provide space for several physician practices. Once the annex is complete, we'll be moving forward with connecting the 2 buildings and additional updates. Second, we just completed a total renovation of the former St. Mary's School on Lawrence Avenue in Potsdam. We've transformed the vacant school to create beautiful new physician office spaces and new space for our physical rehabilitation services. And third, we've begun constructing a comprehensive center for cancer care that will unite the Warner Cancer Treatment Center and the Medical Oncology Unit in the main hospital.
The new Center for Cancer Care and the expanded primary and specialty care space truly will impact every family in the communities that we serve.
These projects are costly and complex, but our goal is simple: to ensure that everyone in our community has access to primary, specialty, and cancer care right here at home.
If you've not experienced cancer firsthand, the emotional and physical toll is hard to imagine. Cancer is the disease that we all fear more than any other. At that critical moment in their lives, that's when patients need us most. We know they deserve to receive comprehensive and compassionate care right here where they live. This is our obligation to them.
I gave birth to 4 beautiful children right here at CPH. I've been an active volunteer on the foundation board for years. But last year tested my faith in this hospital and its people when I was diagnosed with breast cancer. When you're on the cancer journey, as they call it, many will ask where you're going for treatment. Some may think you need to go to a major city, and at the beginning of it all, I did my homework and traveled to 2 major cities to get second and third opinions about my course of treatment. It felt great to know that these opinions were exactly the same as the opinions of my doctors right here at home.
5 years ago, I found myself with a reoccurrence of something that took place in Vietnam and my exposure to Agent Orange. I was diagnosed with cancer. That diagnosis led to 34 trips to Burlington, Vermont, another 40 trips to the Warner Cancer Treatment Center here in Potsdam, and then 2 years of hormone and chemotherapy. The support I received in all cases was excellent. But as you well know, cancer patients find themselves on an emotional roller coaster, And trips of this nature and the kind of weather we have here in northern New York just adds to that stress.
My treatment here was so successful, so why would I be interested in seeing this new state-of-the-art cancer center come to fruition? Simply put, I've learned through it all that we don't have adequate facilities now to deliver the kind of care our outstanding team is capable of.
CPH's Comprehensive Center for Cancer Care isn't about one individual's vision. It's about the vision of a community that includes our medical staff, employees, patients, and donors. Donors who provide us with funds to build treatment facilities and supply them with the best equipment. The new Center for Cancer Care is vital to the well-being of our community. It will house a new state-of-the-art linear accelerator, allowing us to treat many more forms of cancer.
In this new comprehensive facility, patients will have available to them the very best traditional and complementary care that's become the gold standard in treatment and prevention. Only they won't have to travel to get there.
Our leaders need not only the latest technology, they need the facilities to deliver the very best care. And that's why we invite you in our greater community to partner with us to make this possible.
We are so fortunate to have had a hospital of this quality serving our North Country communities throughout these past many decades. Much of that success is thanks to gifts from people like you.
Our patients expect the best, and our mission is to do just that. But we can't do it alone. We need you to partner with us on our journey.
The best part of being a physician is the ability to positively impact the well-being of people in the community. But you don't have to be a physician to help us save and improve lives. You have the opportunity to make that same impact.
Our board spent years of reviewing and planning. We then took a leap of faith by embarking on these projects before launching our appeal. But generous partners are demonstrating that we made the right decision.
Today, you have an excellent opportunity to take part in and support one of the more progressive activities anywhere in the North Country, the construction of a new cancer treatment center as an integral part of the Canton-Potsdam Hospital.
This vision and your gifts, combined with others, will allow us to continue moving forward in our mission.
Let's take our healthcare to the next level. Together, we can make a difference.
Every dollar donated will help us ensure primary care, specialty care, and cancer care. So please, join us in supporting the Canton-Potsdam Hospital Capital Campaign.
Thank you from all of us that have survived cancer, from those that have lost loved ones to cancer, as well as those undergoing treatment today. Your support of this facility can make it a reality. You can make a difference.
On behalf of every patient and all of us who so enjoy living here, thank you for helping us take this giant step forward on our journey to excellence.
You can make a difference.
Thank you.
You can make a difference for all generations to come. From the bottom of my heart, I thank you.